There are lots of challenges to motherhood. Childbirth can be brutal, and if on top of that you have health issues that affect your recovery or that affect how you can actually interact with your child, it can be really daunting.
I spent a year working in Malawi and I saw firsthand women dying of complications related to childbirth. Although as a doctor I could impact that one patient in front of me, by doing research and changing how things are done, you can have a much wider impact.
Here at Women's Health Research Unit at Queen Mary University of London, we are doing cutting-edge clinical research that's focusing on the major problems that are facing mothers and their babies in East London as well as nationally and globally.
The Women's Health Research Unit undertakes research with a view to producing the most reliable and valid evidence. Almost all of our studies are the largest on the subject, and on completion they contribute a large amount of information to decision making in the health area covered.
We run national and international studies with over 13,000 women being recruited into our trials. We also run individual patient data meta-analysis. In one of our studies, we have 3.5 million pregnancies from across the globe.
I started at the Women's Health Unit when I was an MD student about 4 years ago, and I've now got an academic clinical lecturer role. When I first started, I barely knew what a systematic review was, and now I run very large ones that have been published in places like The Lancet.
I'm interested in looking at how women's reproductive history and also perinatal history is associated with long-term health. By gathering big data and big data sets that have a wealth of information from all over the world. By being at BARC, we align the best expertise available in analyzing and harmonizing these data sets.
A major focus of our work is focusing on the problems that are unique to East London, where we are based. We achieve this through BARC, which is a Barts Research Centre for Women's Health, where we do clinical trials in partnership with Barts Health or NHS partners.
It's really important that we are embedding clinical research into clinical practice, as evidence has shown that women who are participating in clinical trials have better patient outcomes. In the pre-pregnancy period, we have a fertility project looking at time-lapse imaging. And then postnatally, we are looking at using metformin to stop women who already have developed gestational diabetes progressing to type 2 diabetes.
It's important to recognize that research is ultimately for the benefit of patients and society. It's extremely important to engage the community and women in planning research and in conducting research.
Katie's team is a patient and public involvement advisory group made out of a broad range of people. The idea behind it is that there's a real diversity of voice in the feedback that we can provide the researchers conducting the research.
As mothers, we can see the process from start to finish, see the planning stages and the hiccups, if you like, along the way, and make improvements.
There aren't very many sites with a focus on women's health, so it was important for me to contribute to something that has that particular focus.
We're involved through the whole life cycle of the research, helping to make sure that all the hard work that's gone into doing those research trials actually translates into clinical practice that's going to benefit the population.
A major part of the work that we do is evidence synthesis. Huge amounts of money has been spent on clinical research for individual studies, but what we need to do is to make sense of the totality of what it all means. We recently published in The Lancet on the burden of maternal deaths in low and middle income countries associated with caesarean section. We found that the risk of mothers dying was 100-fold more in a low and middle income country than in a country such as the UK.
Our research helps governments and the charitable sector to improve the outcome for mothers and babies for its worldwide activities. World Health Organization has designated the Women's Health Unit as a collaborating center. We are in a position to formally offer research and training opportunities through the designation of the center.
The ELI appeal is the East London International Women's Health Appeal. We've run several training courses in places like India and Sri Lanka, mainly teaching midwives and doctors emergency obstetric care. So in India in particular, they've recently introduced a midwifery service within the country, so there's a lot of training to be done. Research can be quite arbitrary if it's not implemented on the ground. What the ELI appeal does well is it joins together the research and the evidence with training in those settings to improve care.
What we hope to achieve really is to continue delivering our clinical trials to provide a robust evidence base in women's health, and also training and involving patients and the public, with the aim really to improve women's health both in the UK and globally.